Today we have with us Dr. Genesis Marian God Pushpam, MD Homeopathy, Associate Professor, Repertory, RVS College, Coimbatore. He is the author of the book Repertory Expert, launched at Sardarshana Homeopathy Medical College. Resource person for tropic hypothyroidism, a bird's eye view at CHA Coimbatore in 2022. Done pilot study on thyroid dysfunction and submitted a report to Asian Journal of Homeopathy as author in 2018. Also presented paper for research proposals on hypothyroid Tamil Nadu MGR University Research Council for the academic year 2016 and 17. Practicing for the past 9 years and concentrating on lifestyle disease and thyroid dysfunction. The subject is importance of ailments in hypothyroid management. We all know that a lot of persons, especially ladies, are affected with this hypothyroidism, and often they when as undetected, especially after the use of this iodized salt becomes a common disease nowadays.
So warm wishes to everyone, for all the practitioners and doctors, and thank you for giving me an opportunity for sharing my views in the form of promoting homeopathy. And thank you so much, sir, and thank you for all who have been involved in this promoting homeopathy. Thank you so much. So myself, Dr. Genesis Maran Gold Pushpam. So I'm in Coimbatore and I'm working in RVS Homeopathy Medical College, Coimbatore. And I have also dealt with thyroid patients for nearly 5 to 6 years around, and a little bit of research we have done. So this is little bit part only. We have already discussed more of thyroid cases probably. Everyone would have treated a lot of thyroid cases and deal more than 100 cases per year like that. But still certain things can help when we discuss in this forum. So my topic today is ailments from importance in hypothyroidism. Mostly ailments from means we can speak in homeopathic point of view as causation. Probably in chronic disease or chronic cases, we'll see for causations if possible. Not in all the cases, but certain times we can see in chronic diseases apart from all the acute. But in hypothyroidism means if we take broadly as endocrine, these ailments from can be possible in this system. Endocrine, it is possible. So if we are able to get such points, then we have to give importance to such ailments from. That is all the only view I'm going to discuss today. It is not that we have to follow only this in thyroid. There is many other types of causation, and this causation ailments from which we are focusing, it is 20%. The 20% where we don't get a result, we can use this type of angle view in our homeopathic part. And I think we got a little bit of assurance in this type of case taking and prescribing. So I'll just share such things along. So before going to the case or files, I just want to tell about why we are focusing on ailments from. Causation means why we have to give importance. We know that ailments from is very much important in homeopathic point of view. So I think these are the contents which we are going to see today. But it's very broad. It shows like that, but it's not like that. It's very simple in understanding. So we'll see. Everyone knows about thyroid and hypothyroid, hyperthyroid. We have some idea. So I'm not going deeply into such type of contents, and we'll just brush up such informations alone, and then we will go further into homeopathic point of view. So as we know, thyroid, it is a butterfly shaped gland, and it is in the 2 inches only, base of your neck and front of your throat. And we know all the details. And the thyroid gland releases specific hormones that travel through the body and regulate vital functions. So thyroid gland has specific hormones and which regulates the vital functions of the body. That is why thyroid gland is very important. Apart from all the other vital organs, thyroid gland bags the weightage more because it regulates the breathing, heart rate, metabolism, menstrual cycle, sexual function, sleep, and especially the mood. Where the homeopathic point of view intrudes is it also manages and balances our mood. So that's why the thyroid gland bags more important. And now, why it is hypothyroid? There are two types of thyroid disorders we know, hyper and hypo. And why it is to be hypothyroid and the mental state means ailments from is hypothyroid, we know that does not make enough hormone to meet the body needs. So the thyroid hormone regulates the metabolism, the weight, and affects nearly every organ in the body. Without enough thyroid hormone, many of the body functions slow down. Hyper, it is very different track actually. Hyper, it means we can see outside, like there will be a swelling over the neck very much, and there will be a little bit of heart circulation problems. We can detect it easily by the reduction of weight. But hypo, only apart from weight gain and tiredness, we cannot assess anything. So we have to keep a keen importance. Sometimes in lab report we will get a normal value, but the symptom always focuses towards hypothyroid. So such things happens in the preliminary state. More beyond that, we can go for other investigations and much more. But since we are symptom hunters, homeopaths or symptom followers, we need certain angle to treat a chronic case and especially hypothyroid. So, hypothyroid and these mental state are very much linked over, apart from hypothyroidism. So, if hypothyroid, the condition is hypothyroid, then the body function will be very slow, and the patient definitely needs some help to regain their normal level of um, daily routine. So that's why hypothyroid backs more important than the hypothyroid in mental state. Next, significance of causation. So we talked about why we need hypothyroid in the ailments from factor combination, and now why it is causation. Why we have to give more importance, or why we are giving importance. It means that causation is one of the elements of symptom which when strong genuine is much benefit in remedy diagnosis. So far we came across several cases cures made by remedial selection on this basis. Means the causation which we are seeing over, it helps to crack a case immediately. If when we feel that there is a standstill in cases of such hypothyroid, then we can also try the causation. We can also ask their history about causation, and then we can go further with the case and we can crack it over. So Boger, he says about causation, actually, he introduced the doctrine of causation into homeopathy actually, because he gave importance to causation, time, and modalities. These three were the key importance for CM Boger. So he also proposed that causation and time factors are more definite and reliable in cases as well as in medicines also. For medicine also we see modality, time, and causation also backs more importance to him. Even Dr. Vidulkar sir also have told that various ways of looking at a case, that is looking at the essence, he says essence, totality of symptom, keynotes, and peculiar along with that causation. These causation symptoms can be considered very strongly because this fits the causation even if it means ignoring other symptoms. Which he tries to say is if a particular case is having ailments from very strong point of causation, we can take that itself as totality by ignoring other symptoms. Such importance the causation have in a case. That's what he is saying in his view. So, if a hypothyroid is having a strong basis of ailments from or causation, or without which we cannot prescribe, then we have to go inside and we have to crack the case. And these two pioneers have been supported causation and they have also experienced. I am just giving the gist. Stress and hypothyroid. So this is the part which we are probably discussing because of ailments from, our body and mind are not separate. They are interlinked with each other. This is what we were always discussing, but still a little more we have to concentrate. As we say that if we get anger, our face turn reddish, and in fear we have paleness of face, and while we are in anxiety, we feel sweat over. So these are all the connection between mind and body. So face is the index of mind. All those things comes under that type of environment. And for recent years, we say a word called stress. Actually, we hear out means this. Even small children, they say a word called "I'm in stress," but the stress is not a single one. It is like a plural. Actually, stress is a very broad word. Inside stress, there are a lot of parts which we can say as I have given like fear, anger, shame, financial loss, death of loved one, disappointment, anxiety, all those things, business failure, everything comes under the word stress. So if somebody is saying that I'm having stress, or the patient we are dealing who is hypothyroid is saying, yes, I'm stressed, means we cannot directly go into medication sometimes. We have to ask what stress they have. It is not, stress is not a final answer. We have to find out which part is affected. So that's why we have to be very peculiar. Characteristic symptoms. That is what Hahnemann says. Characteristic symptom weightage is more, and we have to question in that way. If the stress they mentioned or we know somewhere, then we have to go inside and we have to go for that. So Hahnemann says that state of mind chiefly determines the remedy. Means repertory, without repertory, we can finish the case with Metria Medica itself. That's what it means actually. If we prominently take a symptom, then if we get a drug and we can finish the case over. So the stress and hypothyroid is such way related. Social and psychological stress can trigger or aggravate a wide variety of diseases. I think DCM, disease classification, second sec 2, DCM 2, they have given lot of psychophysiological affection disorders can happen, or 7 systems have been given. In that, one is endocrine actually. Psychological stress. Depression can suppress the immune system, making the depressed person more susceptible to certain infections. Our body responds physiologically to emotional stress. That's what we need. These mental ailments can cause anxiety, and then triggers the automatic nervous system and hormones such as adrenaline to speed up the heart rate and to increase the blood pressure of and amount of sweating. So understanding this is very much needed in our case taking actually. So the body and mind are dynamically interconnected and both directly influence each other. We cannot leave out any part, any one part. So that's what we say as patient as a whole. That's what we mentioned. They both are interconnected. So that is what we go through the psychological process, and a consideration of the mental and emotional state is our best indication, and which we say as indicated remedy. So our remedies will not upset the balance of endocrine secretion. That's what. Not affect the balance of secretion, but it fills the demands of the system in all parts without stimulating too many other organs, which maintain a secure balance. So this is what we assure our patients actually. They will be very much asking like whether we have to continue with thyroxine and we have to take homeopathy, or we have to leave thyroxine and we have to take homeopathy. So we can assure them about such things what I have discussed. Secure balance, that's what homeopathy will do. It will not go, it will finish the demands of the system, and it will not stimulate many other organs or affected, means after effects, which we say. So insulin resistance and issues balancing blood sugar alongside the hypothyroid. So increased levels of glucocorticoid lower the levels of TSH in the blood usually. A delicate balance between stress hormones and cortisol must exist for the proper functioning of thyroid gland. If this delicacy balance changes, then the thyroid may increase probably. The lab test also sometimes cannot detect things which the medications are doing to us, which the stress are doing to us. It cannot depict. That's what I told. Hypothyroid, sometimes the lab report cannot show, or the lab value will be very much border only, or 5 will be 5, 5.5, or 6 only. But the symptoms of the patient will be very more, or they will be having more than 50. TSH can be more than 50, but they will not show any symptom. They will not show even weight gain. So we cannot always replicate with lab results sometimes. That's why we will not wait for the lab report, and we'll go for symptom, and we will be managing. So we cannot always wait for the symptom to appear. Sometimes we will be masked with certain things because of our case taking view. So if we are changing, and if we are asking little bit more in their activities, and when the daily activities is being bothered in a thyroid patient, then definitely they need some help very prominently. So this stress can also lead to the depictity of the daily habits, daily life also. So we may experience hypothyroid symptoms such as fatigue and weight gain. That's what prominently we will see in a hypothyroid. Then prolonged stress also may crop up with depression or anxiety. Both are actually hypothyroid symptoms. So we cannot say that every depressed person will get hypothyroid, or all the hypothyroid are under stress. Both we cannot say. It is both are different. We cannot say all the hypothyroid will definitely have ailments from. We cannot say like that. Prominently, if possible, in some cases, definitely they need some such type of prescription and such type of help. And the symptom also, same thing. We cannot say that all the symptoms will be present in hypothyroid. No, say they, even a hypothyroid patient will have a regular menstruation. We cannot assess like irregular menstruation and hair fall. Okay, hypothyroid. We cannot say like that. Or a thyroid patient. So it differs. But this part of this ailments from causation also, it cannot be in all the thyroid patients. Some patients they may be in such type of degree, and if we oversee, then we will be achieving the result which we want. Psychosomatic category. That's what. It's now commonly referred to psycho physiological illness, means which symptoms are caused by mental process of the sufferer rather than the immediate physiological cause. Means if a medical examination can find no physical or organic cause, or if an illness appears to result from emotional condition such as anger, anxiety, depression, or guilt, then it may be classified as the psychosomatic. For example, if I want to explain like why we have to give, means everything how we can say stress, and many people can overcome the stress very easily. Why we have to go like stress is very important, we have to see why, what's the reason. Means if we take, for example, if we take a day, if we are injured in our leg, or somewhere we are being affected when we go for work, somewhere a knife cut or something happened, we will manage it easily. We'll put a bandage, or we'll put something we will do, and we will go further. Even to our work, we will go correct time, everything we'll do. But at the same time, when you feel like you have been lost somewhere, or your mood is not fine, your mood is swinging, or you're not happy today, then what we say is, the first word we say is, my day is gone. Even though at 9 o'clock means 8 o'clock, 9 o'clock punching, or 8 o'clock means even though we have a lot of time, we feel like, why to go outside, why to, my day is gone already. So we'll come to conclusion. So that is where a mind stands. That is why Kent says that mind governs the body. So every pioneer has their own view. So this is why we give importance to mind category, actually. So if we can say that psychosomatic and endocrine are probably in the same race code, then we can go and have a simillimum if we get the possible symptoms. So the psychosomatic are among most common disease. Okay, then it's a condition of dysfunction or structural damage in bodily organ through inappropriate activation of the involuntary nervous system. And this is mainly physical disease which is thought to be caused or made worse by mental factors. So this mental factors is, as I have told, is very broad, and we have to come to a conclusion. So forever what the patient says, then we have to come to a conclusion by interrogation properly and ask explanation. That is very important. See, even if we find that there is some cause, there is some ailments in a particular case, actually we have to confirm that. We cannot immediately go into that. That's the only way, because the only way to finalize the causation is observing the patient. Observation. We have to observe them, whether the guilt patient means that the guilt person, we cannot say patient, person, guilt if they have, then the particular observation should be of guilt. By saying words, certain times will be deviated. So we have to observe the patient's activities also to come to a conclusion in such type of cases, because hypothyroid person will be always in the slow state. Actually, they will not be very active, and sometimes the active person also, we can go to such characters also. So with this, actually, we have dealt with many hypothyroid cases for the recent years, and among that, for our causative factor, I have occluded certain aggregated form of hypothyroid case file. So we'll be going very quick with that. Miss, we can also explain in between. Also, I can explain further. So not only with only theory part, we are also have done a research type of file reports. So just I want to share with everyone regarding that angle of point of view of what we have done and how anything have helped or not. So if we are going with the hypothyroid, then we have seen more than 50 cases of hypothyroid. In that, 30 cases were taken randomly according to ailments from which we have seen causation. We have seen, so 30 cases sample size, and it was along the around Tamil Nadu. It was around like Nagakoil, Kanyakumari, Madurai, Coimbatore, and probably this Nagakoil, Kanyakumari border, everything they were having hypothyroid most recurrently, and breast cancer also. There was a report in 7 cities of Tamil Nadu. They have taken in Times India report. They have taken like Nagakoil, Kanyakumari, and the sea areas, seashore, the sea areas. They have more number of hypothyroid cases and also breast cancer. 3 years back, they have given a report before COVID. They have given. It is available in net also. So like that, in other cities of apart from Tamil Nadu, other state also they are having 7 cities, means like Bangalore, Chennai, and then Delhi, 2 or 3 more places. They have taken overall 100 patients of the hypothyroid. They have taken and they have reported like many were having a stress disorder type of case recordings. So we also have such reports also, but this is available. This what I am producing now is only inside Tamil Nadu, certain places from where the patient have come and reported us. It is not like we went and asked, like they came to us and we have recorded. That's all. So 30 cases by simple sample, and we were having like inclusion exclusion criteria, means they should not have any cancerous conditions, and age group is not mentioned. Anyone can, but we have kept like after pediatric age group, means from 15 years, 16 years to the 60, 65, like that. So in that 30 cases, this is what the report we got actually. The 30 cases, probably 11 patients, they were 35 to 45 years age group. In that 30 hypothyroid patients, probably 35 to 45, they were all having hypothyroid, the category. And apart from 45, 55, probably they were not the 30. Then females were affected more. That's what in all the report, most of the reports, hypothyroid female are the probable affected group, hypothyroid. So this also was in for us also it came like 27 patients in 30 persons, 27 were female. And occupation, this we have to note actually. 17 cases. In that 17 were housewives. See, we have 27 were female. The 27, 17 were housewife. Usually we say this is what we cannot access anything actually. Means we say like those who go for work or those who are in heavy work, brain works, they have more stress. We think like that actually. We think we are probably last maybe 6 or 7 years back would have been, but now it is not like that. 17 housewives, they are at home, but they are stressed more actually. Beyond private employees, students, and unskilled labor, they housewives bagged more. So they were having hypothyroid probably. Socioeconomic status. The lower class economic status people were be having more hypothyroid. This why we have categorized this is the awareness for them was very low. Means they don't know that they are having hypothyroid. That's what we have to say. That is for the only reason we have stated this economic status. They were not aware what to eat and what to not eat. Because educated people or those who know about thyroid, we will be already assessing what to eat, what not to eat, and what to buy and what not, what fresh to eat and what not. Do's and don'ts we know actually. But these people actually they need our help. They don't know what diet to follow, or they don't have the capacity to buy such things, or they are not aware if it is hypothyroid is untreated, then how it will be. They don't know. They are not aware of that because already the factors of environment, everything affects them. So they don't know. Such why the ranking for them is very high. So they need definitely they need our help actually. How far other schools of medicine will help, we don't know, but definitely we can help them to reduce their rankings of this type of hypothyroids. The symptoms of hypothyroid actually tiredness of whole body. This is what most of the patient had. Tiredness of whole body, not a single part overall. If they work very little, they'll be for example, a 5 minutes, 5 minutes or 10 minutes they'll work, and they feel like they want to rest for 1 hour or 2 hours. The tiredness was very more, especially when they use their brain for calculation or something. They feel like fatigue. They feel like very much um, interrogated, means they cannot they are not able to stand up and do their daily routines. So tiredness was very much more. And constipation. And constipation also, apart from this 30 cases, we have seen like while before menstruating, the constipation comes for some hypothyroid cases also actually. We have symptomatically treated, but this point, constipation before menses and after menstruation, probably will be okay. So such symptoms also pops out in between. If it is bagging more importance, then we can treat that also. Then only comes weight gain actually. Weight gain, then periorbital puffiness means around the eyes. If we see periorbital puffy, for diabetic patients, there will be sag here or below the orbit. There will be sag like thing actually in diabetic. We can see by that's what the observatory points which we can see. Sometimes patient will not be aware of diabetic like lifestyle diseases, but when we observe things in their faces, then we can come to a conclusion, ask them or make a test, or we can give medication, such things, or go deep into the case by observatory points. That is what very important for us in case taking. That is also one type of case taking only, observing. So the sag will be in diabetic and the periorbital puffiness will be in the hypothyroid actually. Then hoarseness of voice, they were having more. Then dry skin. If you see the skin of hypothyroid, means probably beyond 10 years or 15 years they're having hypothyroid. Means you can see the skin will be like cracking, like old people will have the skin, you see, like cracked dried skin. So such type of skin appearance will be there in the hypothyroid patient. And then slow movements. Then coarse skin, cold will be, means the intolerance of cold will be more in hypothyroid rather than other types of means Hashimoto's, hyper, all the things. Hypo is very slow actually and very cold. They cannot tolerate cold. They cannot, even though a patient was hot patient, after hypothyroid, after they get thyroid, this hypo, they will be a chilly patient actually. They will be intolerant to cold like that, and they'll be very much, the immunity will be very much affected. Paresthesia, diminished sweating will be there actually. But certain things, we cannot say that a hypothyroid patient will have all these 10 symptoms. It is not possible. It can be one or two, maybe, or five or six, maybe. Even only one thing will be there, weight gain. Other than that, there will be nothing. Or you can take as tiredness of whole body. That also will be there. See here in this 30C, hair fall I have not mentioned. I don't know whether you have noted hair fall. So we cannot say everyone will have hair fall and thyroid. We cannot say that. But hair fall was also only one condition for a patient with hypothyroid. So we cannot go this type also. We cannot go that beyond also. So probably these two things can also be dedicating towards the hypothyroid. So that is why we give more importance to hypothyroid person, because we cannot assess whether they are with hypothyroid or not. If the symptom is not in front of us, if they don't have any symptom exhibiting, or if we see lab value, there will be a hype in TSH. But beyond that, there will be no any symptom. If you see them, they'll be okay. It will be like hypothyroid. When we go for test, the test will show us hypothyroid. So this is why we need help. We need to help such persons, because we cannot assess it immediately by physical appearance. So in this type of research, means this type of case file, we have used one tool, that is synthesis repertory. We have used synthesis repertory. This 30, beyond 30, we have treated with synthesis repertory 9.1 version we have used actually. Why we have used synthesis repertory beyond the Kent repertory? There is a question like that, because Kent repertory is sufficient for all type of cases, means whether it is a characteristic symptom, characteristic particular, or mind physical characteristic. So if we have all these three, then we can use Kent itself. But why we chose synthesis is only one reason we have chose that, because there is a rubric, mind chapter, there is a rubric called ailments from. It is there in only one repertory, synthesis repertory actually. That is why we chose not Kent and we have gone for synthesis. So this book actually having 38 chapters, like Kent only, basically. Because after that only synthesis was compiled actually. The best part, this was compiled. Same way, bold, italic, all those things. 3 gradations are there. And then it is more than 2 lakh additions are there. 330 sources. Means like that. Then um, similar means this is all comparison of Kent and synthesis, why we chose actually. Additional remedies are more than Kent. Additional remedies are there in synthesis. This is what I want to say. The only repertory in which ailments from rubric given as a separate main rubric, under which many sub rubrics are arranged. Actually, if you take a repertory, means it is not that every time we should use repertory. There is one condition for repertory actually. If we take a case of a person, we are taking the case actually. We should not be prejudiced, and if you are taking the case, probably come to a conclusion. You feel like the person will be a character. Means after taking the case, after finishing the case, we feel like we can give lachesis, we can give Arsal, or we can give aconite, or we can go for pulsatilla, or we can go for lycopodium. If we feel the case is very similar to particular drug, then we have to prescribe. If you are going beyond, or if you're not prescribing ourselves to that case and you're coming for repertory, you will be deviated. This is the only condition for using repertory actually. If it is similar, then we can prescribe. But if it is not, and if you need some help, or if you need some reclamation, then we can go for repertory. So for them, we have used synthesis repertory because of this ailments from rubric in mind chapter. Inside the chapter, usually if you see, the top will be chapter name in a repertory, and then if you see a bold thing is rubric. and inside what they have given is sub-rubric. That's all how you use repertory. In that rubric name will be ailments from. If you see a synthesis repertory, mind chapter you take and you will be seeing ailments from. In that ailments from, there are 115 sub-rubrics. Inside that ailments rubric, we have 115 sub-rubrics are there. And definitely this section, mind section, is very much important in synthesis repertory. One more thing is there, the laboratory investigations, lab result, directly they will be giving medicine. That is also available in synthesis repertory. Both extreme they have given in synthesis. So we can use synthesis for such types if we need, and we can easily go through and get similimum. So here the ailments from, it is given like, see, I have given you example. It is given, it will be given like this. Some few, it is not, I'm not given everything, just simply mind ailments from anger with fright. Usually we will read the rubric from backside. Backside we can read and we can get a conclusion. With silent grief, anger, ailments from. Then see, for not being appreciated, ailments from. We will not think such things actually. We don't accept that such mind symptoms will lead to a very big disease. We will not, we are not, we are aware, but sometimes we will not able to believe. We also were not able to believe such things. But a bad news can make a person depressed and go to a disease. From being betrayed, we know only one word actually, insult. Usually insult we'll take, and ailments from insult we'll directly go to a drug, we know. But certain things, when the particular drug when doesn't suit the person, then we can go for repertory, rubric, everything we can go. Beyond Mathematica, we can go. So from being betrayed itself, ailments from. And then business failure, like that. See, from being criticized. This why I have not added any medicines here. Because I'm just, I want to give a intro that there is such chapter, there is such rubric, and there is some such type of angle to a repertory. So that's why I do not add any medicines which have been given in the repertory, because I'm not focusing on that. That's why. But if you have synthesis repertory or the app which you have, can use and see whether the medicines which are coming inside, whether we have some idea about that, you can see in such apps, applications, or the repertory book. See here, death of loved ones, children. When a child has been dead, then that becomes ailments from. Parents, then from being deceived, disappointment. Now see the last word, discords, chief and subordinates. See, chief, between chief and subordinates, discards, ailments from. That also can lead to a disease. And we easily see, for example, if you think in front of two or three persons, those who are junior to us, if we get anything ridged between before the juniors, if we get any allegations or if we get anything from our senior or superior, we feel very much low. Sometimes it can affect and become like inferiority. We don't know when the person changes, because we cannot, every time we cannot take it easily. Everyone cannot take it easily. For me, certain things are very, very little bit. But for others, the same thing will be very more. For others, it will be very more, a particular thing. But for me, it will be same thing. For me, it will be, let it go. It's okay. So we cannot assess a person by what we feel. I feel that this particular thing is very small. So with that, we cannot criticize other one that this is very simple only. Why are you doing this much? Why are you feeling this much? We cannot ask. That's what Hanuman says. We must not be prejudiced. We cannot assess by our stomach pain that others will also have the same type of pain. So this is what we say about ailments from and how it is very important. And this friendship, diseased friendship, and then homesickness, honor wounded, that is also comes under insult type of, and jealousy, homesickness, all those things also comes under ailments from. So these type, this is one part of thing which I've given an ailments from rubric. But still more there are many such rubrics. So I have just given a sample only here. So how these ailments, how we have managed, what all ailments from in our patients, that 30. That is what I'm going to give you. This is what suppressed anger. Suppressed anger. So probably suppressed anger and rudeness of others. That was taken more, and then grief and financial loss. These four things bagged more. So every, if possible, maybe next time we can discuss about a single case about why we have taken a suppressed anger or why it is rudeness of others. Because it is a word as rudeness, but all the five were different. That's what I want to say. See, the 5 persons number of cases are suppressed anger, but all the 5 were not having the same situation. It's different. So that is why we have aggregated. Every case is different and it is individualized. So suppressed anger and rudeness were more in 30 patients. So before, it was all the symptom which I have told you was 80, and then became 47. So probably we had a balanced form, and we cannot say immediately TSH. We have to check only 3 months once. So this was the third report. We will not go for the next report for our after report, because hype can be there or low can be there. So third report we will be assessing actually. So we have tiredness was much reduced and constipation. So improvement was marked is 50%, moderate was 43, and mild and was standstill was 6%. The truth, because we also need some time for the patient also to come across, and much we would have mistaken or we'd have deviated. We have to go and ask. The 6% needs some study still more. So there is some improvement. It is not that the cure or curative path, recovery, but there is some change if we go with ailments from also. That is also one of the angle, because lot of causations are there, family history, hereditary, lot of things are there. But this is one type of angle. When we feel that one hypothyroid, it is not properly treated, or the standstill condition, if the angle which I'm saying in that 1%, then we can treat like that. It is not for all the hypothyroid, but certainly if there is ailments from, definitely we can help the person. So conclusion is, various prescriptions are treating, considering the causative factor which is placed in mental plane, will have a massive increase in scope and assurance for our curative rate also, which becomes more reliable, complete than any curative formula, which states hypothyroidism is incurable. So we can help certain state of people with hypothyroid. And that's what I conclude with my topic today. And thank you so much for giving me an opportunity. Thank you, sir.